Hello and welcome to another edition of the Brian A. Joyce Report. I'm Senator Brian A. Joyce, and I have the honor of representing you and your family along with the towns of Avellone, Braintree, Canton, East Bridgewater, Easton, Milton, Randolph, Sharon, Stoughton, and West Bridgewater in the Massachusetts Senate. The purpose of this program is to keep you up to date on what's happening in the legislature as we discuss the vital issues that affect your lives every day. We'll also introduce you to some interesting guests who are some of Massachusetts' most important decision makers. Today I'm delighted to be joined by Joe Avellone, who is seeking the Democratic nomination for governor for the 2014 election. Joe is a very interesting guy who has extraordinary qualifications. He's a physician, a surgeon, a CEO, a COO, a lieutenant commander in the Navy, just an interesting guy. So, Joe, thanks for joining me, and welcome to the show. And you do your resume a lot better than I do.
Well, thank you, Senator Joyce, for allowing me to come here and be with you. I really appreciate it. Yes, I am running for governor, and I am coming from the private sector. I have spent most of my career in healthcare. I went to medical school at Harvard and became a surgeon at Peterman Brigham Hospital because I wanted to help people. That really has driven my career. After a few years of practicing surgery, I recognized that I could help more people as a leader or a manager in our health system. And really, for the last 30 years, that's really what I've been doing. The health system still needs a little work, but it has changed over time. So over that period of time, I was the Chief Operating Officer of Blue Cross and Blue Shield at a time in the 90s when we formed HMO Blue and really transformed Blue Cross, but also controlled our medical costs during that era. And then for the last 15 years, I've really been in the biopharmaceutical industry trying to lower the cost and decrease the time it takes to develop drugs. So I had a startup company using the internet in the early days of the internet that identified and qualified and informed people about clinical research trials and then matched them up to the trials, all in an effort to try and advance the recruitment times and shorten the period of time for these important clinical trials that prove whether drugs work or not. Then for the last 7 years, I've been running a very large global division of an international medical research company. It's called PowerXL International. It's based right here in Waltham, Massachusetts. But we have 15,000 employees in 50 countries, about 2,000 in Massachusetts. And our effort is, once again, to try and lower the cost and accelerate the timelines of these wonderful new drugs for cancer and diabetes and heart disease and all the rest to get to market. So that's been my career in healthcare. But along the way, I've learned a lot that I think is very relevant and why I think I can make a large impact on in being governor going forward.
How's that for an impressive resume? You didn't touch on you didn't touch on your military service.
Thank you very much. That's true. I did join the Navy, the Medical Corps Reserves in 1979, right at the end of my residency. You know, I had been in medical school during the wind down of the Vietnam War. I didn't really agree with the war, but I was very moved by the sacrifice of the people my age that had gone and fought and been part of their approach to service for our country, and so I thought I owed something. So after my residency, years later, I did join the Medical Reserves. I was attached to the Marine Corps unit in New England and was a Navy medic, medical surgeon, I should say, and very proud of my service there. I ended the service in 1991. It was all peacetime, so not near the service that people who have gone to war, but I learned a lot about serving our country from the young Marines that I was attached to all that time, and I'm very pleased that I had the opportunity to do it.
You also did some hand-to-hand combat in Wellesley as a selectman, right?
Yeah, that's right, Senator. I was a selectman in Wellesley for 6 years in the 90s. It was a great experience. I think many people in our towns in New England in particular get involved in local politics, and to me it's a very rewarding thing. It is interesting though, dealing with public budgets and with services that people care a lot about, safety and health services, et cetera. You know, these services are very close to people. So it was a great experience for me to learn how to deal with a public budget, how to work with police and fire unions in my case, and large projects like changing the whole streetscape and enlarging our main road in Wellesley. So I think I learned a lot that positions me well for government. I also learned to work with the legislature, both there and at Blue Cross, which of course is an important element of being the governor.
All right, so you're from Wellesley, married with 3 children, went to Harvard Medical School,
Yep.
Kennedy School of Government.
Yes, that's right.
You were COO of Blue Cross Blue Shield, CEO of a startup medical company that went public, or you sold, and
No, we sold, yeah, Veritas Medical.
were a surgeon,
Yes.
and now, or just took leave from running the global division of a medical device company.
Yeah, it's a medical research company, yeah, Parexel. And really, that was that experience, I think, has more to do, that and my Blue Cross experience, with helping the state. We have a global business. I have been competing in the global marketplace with global clients, global competitors, and I have a global workforce. And what I see is the quality of that workforce around the world and where other companies are starting and building their businesses. And it's important for Massachusetts going forward to have the right kind of work skills here to compete for the new businesses. And this is what I think I've learned and what I know to do. I know what my own company does around the world. We have academies that we work with university systems in some other countries. We have academies in Germany and in Singapore and in Japan. And we have a much more seamless pathway from students who have been in those university systems into our company. And this is what other countries are doing more than we are doing. And this is what we need to do differently going forward for workforce development. We have to create these skill sets that are necessary for the new businesses in Massachusetts in order to attract new companies here. And in fact, in my own company, Parexel, right here in one of the life sciences capitals of the world, we didn't have enough of a certain kind of employee to monitor clinical trials, to work with the physician offices that are managing these clinical research projects. And so we developed a program with Salem State where we essentially, they go through the program, it becomes for credit for them, and then we hire these folks into our company. The state needs to do a lot more of this, a lot more proactively, and a lot more strategically in order for us to create new businesses here. So I've learned this. I've learned it, how we've done it in our own company, but more than anything, I know what the state now has to do. And at Blue Cross, I've worked with all our major institutions around the state, and I understand what we have to do to control healthcare costs going forward. I think we have a wonderful system now that we have universal access, and we've had it for 7 years, so that everybody effectively is insured. But now we have to go to step 2, which is essentially creating an affordable cost structure. Or we could lose universal access, as tragic as that would be. You probably remember, and I certainly
So let's talk a little bit about that. So a couple of things. First, you talked about kind of the new skills, the life science, the biotech, capitalizing on our intellectual capital, our well-educated workforce in this new economy. We can't compete, obviously, on labor costs with China and other low-cost labor markets, but we can, and we do successfully in life sciences, biotech, in utilizing our great intellectual capital. But what about those folks that are in the manufacturing economy, are in the kind of the old economy?
Old line industry.
Is that coming back, or what can we do about those folks?
No, this is a great question. And I used life sciences as an example because that's where I've worked. But I think the new kinds of businesses that extend well beyond life sciences into other kinds of manufacturing are the future. Because, to your point, I think the older declining industries are not coming back. I think this is a hard lesson for us. But even as the economy improves slowly, and it really has not improved yet in many parts of our state, even as that happens, I don't think we're going to see these older industries rebound. And I think we are going to continue to see a dwindling of certainly of heavy manufacturing in most respects. But I do think that we can build new kinds of light manufacturing, precision manufacturing, smart manufacturing capabilities here, once again, by educating the workforce that will bring the new companies here. And this is our future, not only in Massachusetts, but probably in America overall. The higher value-added manufacturing is where we need to make our mark. And people say, well, gee, how could that ever replace all the jobs that left with these old line manufacturers? And in some respects, they can't replace all the jobs, but if you bring capital and wealth into the community from these new manufacturing, it generates lots of economic spin-offs, so lots of other businesses can form around them, and that will employ lots of people. I would say that this is where we can compete and China and many of these other countries can't. It's the higher value added new kinds of manufacturing. And this is where I think we need to focus.
But even the manufacturing jobs, it's part of this so-called jobless recovery, because many of those jobs require far fewer people, right?
They do.
Robotics and automation and the like.
No, it's a great point. They do, but they bring a lot of economic activity to the area. So even if they don't employ the 10,000 people, if they employ 2,000 people, it creates a lot of economic activity around them that ultimately does employ the 10,000, either as suppliers to those new industries or even as services and other kinds of smaller endeavors. So
do you think by virtue of your experience, that makes you qualified to kind of lead us in this direction, this new economy, and this new economic recovery?
Yeah, I think so. I mean, I've had direct experience now running 2 large organizations, Blue Cross as the COO and this company as the senior vice president of our core business. So I've been parts of teams that have created thousands of jobs over the years, so I'm very familiar with how we grow jobs. And I'm very familiar with what the competition's like around the world. I think this qualifies me well for the new economy that I think we have to grow here. I would say that I just want to emphasize that it goes well beyond life sciences. I think this applies to software, an industry that we definitely need to nurture. I was disappointed with the software tax when it came out, and I was I think the only Democrat, I know it was the only Democratic candidate that came out against it in the beginning, not because I don't think that we have revenue issues, but because this went right at the center of one of the industries that we really need to develop here. It's interesting about software, at the end of the...
But it was repealed.
Yes, it was repealed. No, thank you for saying that. It definitely was. So in the end, I think everybody recognized it wasn't the right thing for this industry in particular, and we should find the revenue somewhere else. I would say that, after the demise of the large mid-sized computer industry that we had here with digital and the others, it went to distributed processing, innovation moves on, and then the next thing was software. And we had a lot of software companies here 20 years ago, Lotus and many others, but they didn't stay here and they didn't expand here, and they're in Northern California. That's not a low-cost location. They went there because they nurtured that industry. They created the environment, not only the work skills, but the other parts of the environment that would allow that industry to grow. And that's what we have to be very targeted about going forward.
And to his credit, I think our current governor has done a good job in nurturing the life science
he has,
in biotech. And I think we've seen, as a result, right here in this district, here in Canton, for example, companies like Organogenesis or in Cambridge, Kendall Square, that are just booming with these biotech, life science, pharmaceutical type companies. And I think that the current administration deserves some credit for that, but it goes to your point that sometimes you need to nurture these industries in their early stage, embryonic stage, so that they grow and prosper, as Silicon Valley did, I suppose, some 40 or 50 years ago. You mentioned that we're going to a new economy, and the manufacturing jobs are, that economy perhaps isn't coming back. That shows one of the challenges that we have as policymakers, because you also touched upon the software tax. In Massachusetts, we have this somewhat outdated tax system that's based on an economy that essentially no longer exists. And so we saw former Governor Dukakis back in the late 80s try to tax services, because we're primarily a service-based economy, and that just, it blew up on them. And then we saw this recent foray into taxing software, and that was repealed. But it shows some of the challenges in generating income or generating revenue to support some of the programs and policies we care about. One thing, you also touched upon another very important part of the role of chief executive for the state is containing the healthcare costs. You talked a little bit about that. We passed a bill a couple of years ago which, I think folks like to crow is going to save some, $200 billion over the next 15 years. I'm not sure where those figures come from and how valid they are, but it's really, I think, containing the growth of the cost.
Yeah,
it's
it
not
is.
actually
Slowing the growth.
slowing the
That's
growth.
right.
So, but talk a little bit about that.
Let me speak to that. First of all, that is the other, I think, big issue for the balance of this decade, and for us to essentially come out of this long, difficult recovery.
I'm going to hit you with the third issue.
Okay, good. But healthcare clearly is big, and what we have to do is actually change the way healthcare is delivered in the state and move towards more what are called more organized systems of care. So this effectively means moving away from the uncoordinated care that we all exist in today, that I actually practice surgery in, and fee-for-service, and move towards larger groups of organized physicians managing populations of patients with agreed-upon practices on how best to treat a cardiac patient, how best to treat a diabetic patient, and measuring outcomes. That's sort of a mouthful, but it equals more organized care the way we would organize almost any other enterprise, which doesn't exist in medicine today. The good news is, not only is that a much more stable cost structure, but it gives better outcomes for patients. Doctors like it better. And there are many examples in the country of these kinds of systems working, and even elements of it here. And I know Milton Hospital here in Milton is now part of BAJ Deaconess. Mm-hmm. And these systems are going to form, and it's going to take some years. So the framework for doing it was passed by the governor and the legislature in the Health Care Cost Control Act of 2012, I believe. And they set up the Health Policy Commission. This creates the framework. What we need to do now is start moving down the road with this framework towards having these systems of care develop and having the contracts between insurers, both public and private, reflect the system that I just talked about. So I think, to his credit,
so to put it
he's
simply,
created the framework.
To put it simply, what you're suggesting is kind of the way we're going, and I think you'd be a good person to be at the helm of this, but rather than just fee-for-service, go have another MRI, we'll pay for that, go have this, we'll pay for that, and go see the doc when you're sick. You're talking about giving essentially responsibility, the patient and the docs together in a group. We'll give you this much money, keep this group healthy, some preventative.
Yeah, and that allows them the freedom to spend the money effectively on the patient where it counts. So more upfront preventive and early diagnosis, less expensive services with everybody trying to operate, do more things because that's what.
I'll tell you, we watched the Patriots game yesterday, and everybody was wearing pink, and we're all celebrating breast cancer awareness, which is extraordinarily important. But it makes my wife crazy, in that she thinks the focus is too much on treating rather than preventing.
Yeah.
And I once heard somebody, I attribute to whoever said it, but I can't recall who it was, but where we have a system with thousands and tens of thousands and millions of people going off a cliff, and we're spending more money on having the ambulance at the bottom of the cliff to take people away and put them in the hospital, rather than trying to prevent them from going off the cliff. With perhaps better nutrition and better.
Yeah, and we are a society now. This is exactly right. Of long, expensive chronic diseases, and so we can intervene a lot earlier in a lot of these things, and then a lot of the new treatments and drugs and things that we're learning will allow us to do that. So this system, this is going to be better healthcare for people, better for doctors, and more stable cost structure. Healthcare is always going to be expensive. We are an aging population here in Massachusetts as well, and in America we have more of a high-tech approach to medicine. All of that is fine, but it doesn't have to be nearly as uncoordinated and inefficient as it is, and that would save an enormous amount of money. And right now, as you know, not only do our healthcare costs continue to rise and squeeze families and businesses, but it's 40% of the state budget. So that's up from 20% about 12 years ago. So that is a huge burden on the state, and the answer is not to not be able to do anything else. We need to make some other investments in education and workforce development and infrastructure, but it's to actually change the system to start to control these costs, because we know we can control these costs better. But it's going to take somebody in the governor's office that understands this, that can work with these large organizations. I think I can do that. Okay,
so you're going to help create jobs. You're going to help control costs for healthcare. What are you going to do about the schools? So the third challenge.
That is the right challenge, the third one.
It is. Yeah. And so we have among the best schools in the nation. We test first in virtually all categories in the public schools.
Yeah.
And yet we're not testing first worldwide. We're not necessarily preparing all of our children to compete in a global economy. We have these huge achievement gaps between communities. What would you do to address that?
Well, I'm glad you brought that up. I am going to be publishing my education policy in a couple of weeks, and it's going to focus on two things, just as you said, closing the achievement gap and making every student college and career ready. But let's talk about the achievement gap. To me, this is going to be my highest priority. I think every year we have literally thousands of kids coming out or dropping out of these underperforming schools in too many of our older urban communities in particular, have no place to go in the new economy, and they have no place to go in this economy, let alone where we're headed. And so this has got to be our highest priority. And my plan will address it. It will address it with where the biggest levers are. I plan to go after the what are called the at-risk level 3 schools, and certainly the lower performing schools at level 4. That's the way they rate schools, and use the things that we know work. So that includes funding pre-K education. We know that early childhood development really has a huge impact and can make a huge difference on graduation rates.
I was going to lead to that. So
Yeah.
This isn't anecdotal.
No.
There are statistics that show the earlier you get to a child, universal pre-K, for example, you support that?
Yes.
So if we could get to children at an earlier age, it's demonstrably proven that they will achieve more later in life, and yet it seems like we don't focus enough on that.
We don't, and it's interesting that because this is the biggest lever we probably have is early childhood education, and the results are proven now many times over that the graduation rates are much higher, the repeat years getting to graduation are much lower, the special ed costs are much lower. So actually, it costs a lot less to actually fund pre-K. So I'm going to set up a special fund through the legislature that I'm going to have them appropriate that allows us to fund, especially for the at-risk schools, pre-K education, and then track the progress. And if you can get a large share of these students to be literate at the 3rd grade, then you see all the benefits over that 5-year period. Then you see all the benefits thereafter of lower remediation rates and all the rest of it. And those school districts can pay back into the fund with the lower costs from having these much improved students' performance. This is the way to get at this problem. And then there are other elements around enrichment programs and lengthening the school day for those, and some other innovative things that will be in my policy. But it's going to be my highest priority.
So I try to throw 3 things at you, right? Jobs and healthcare cost containment and education. You hit all 3 out of the park. We only have a few minutes left, and it's an opportunity for you to just make a pitch, because you're extraordinarily successful, impressive guy, but you're new on the public scene. So you're Joe Avellone. You're from Wellesley. You want to be governor. Why?
Thank you, Senator, because I think I can make a big difference. I think my background and my skill set is right for the times. I believe that every politician has always said that the next election is the most important one. I really think that's true in the governor's election. I think we're going to chart our path forward on all of these huge dimensions in growing the economy. And I think my experience in creating jobs and global competitiveness, my experience with controlling our healthcare costs as the COO of Blue Cross, positions me very well in a way that none of the other candidates really have. I'm not as well known, so I have started early. I've been in 110 towns. I am running full-time for this job. This is where I think I can make the big impact, and that's why I want to do it. I would love everybody's help, and in fact, I don't know if I can throw out an advertisement, but go to my website at avelloneforgovernor.com, AVELLONE forgovernor.com, and you'll see more about my plans and my thoughts. But I think that we need somebody from the private sector who's had these experiences now to chart our course going forward, and that's why I would like to do it.
Thank you. Very well put. So I will be having all the candidates, or all the candidates who accept the invitation will have an opportunity to make their same pitch, including the likely Republican candidate. So I think an informed electorate is well served in this democracy. So I have been very, very impressed with this first candidate, Joe Avellone, candidate for governor. You'll be seeing a lot more and hearing a lot more about him over the next year or so. Thanks. I'm Brian Joyce. That I think ends our program. It's been a pleasure. I've not had a show in a while, so I'm a little rusty, but I think that Joe was a great guest to start our new season. Thanks, and until next time, I'm Senator Brian Joyce. I appreciate the opportunity of serving you in the Massachusetts Senate.